Hello, Commissioner.
Afternoon. Good afternoon. If I can get it off mute.
There you go. Do you want me just to start, Janelle, or did you need to say anything first? You ready for me to go?
I think we can start with roll call. Yeah, please go ahead.
Okay. Well, good afternoon and welcome to the public meeting of the Silver State Health Insurance Exchange Advisory Board. My name is Valerie Clark. I'm the chair of the Silver State Health Insurance Exchange Advisory Board. And I will now call this meeting to order and take roll call to make sure we have a quorum. Board members, if you're on here, please identify if you are present when you hear your name called. I will start with our voting members. Angie Wilson. Is Angie Wilson on the call?
I just want to make a note. I think that the script may have a typo. Angie Wilson is no longer on the SSHIX advisory board. So
Okay.
there's a roll call sheet.
Do you have that?
Yeah. Would you like me to take the roll call and then we
Yeah.
can make a note to John Pishon has taken the governor appointee seat that previously was held by Angie Wilson. I don't think, I'm not sure if he's been completely sworn in, but my understanding is he was going to attend the meeting. Oh, it looks like he just joined. Okay, great.
Yeah, I'll let you take roll call. That'd be great.
Okay, sorry about that.
That's all right.
All right, I'll start with you, Valerie Clark.
Present.
Miss LaVon Lewis. John Pishon.
Present.
Oh, welcome.
Thank you.
Dr. Tara Rains. Ann Jensen. I believe she's attending, so I will mark her present as she arrives. Commissioner Ned Gaines.
Present.
And Melissa Bullock. And then do we have ex officio member Tiffany Greenemeyer or Curtis Palmer? Are you sitting in for her?
I see Curtis, his name.
Yeah, that's okay. All right. I'm just seeing if Anne has arrived yet. Doesn't look like it.
I do see John Pishon. If did he already say he was here? I'm sorry. Okay.
Yes, he did. So I have only 1, 2, 3 board members who are present. So I don't believe we have a quorum. So I'm not sure, Jose, if we need to wait on the next for possible action agenda items. Is that correct?
You could cover any informational. Unfortunately, you wouldn't be able to take any action on any items during the meeting.
Okay. How many are we missing, Janelle?
Let's see. 1, 2, 3, 4 right now. We're missing 4.
Okay. Shall we just proceed and then see if we get any additional people as we go?
So I think that puts us at public comment, and then we'll move on to executive summary. Is that correct?
Yeah, yeah. Okay. The second item on the agenda offers an opportunity for public comment. No action may be taken upon a matter raised under the public comment period unless the matter itself has been specifically included on the agenda as an action item. To provide public comment telephonically, you may join the meeting by dialing 775-312-6111. And when prompted to provide the meeting ID, enter 667-600-603 pound, and then press *5 to raise your hand during the public comment periods to provide your comments. Persons making comment will be asked to begin by stating their name for the record and spelling their last name. If you wish to provide public comment and joining by phone, please press *5 to raise your hand. If joining by computer, use the raise hand icon at the top of the screen. Do we have anyone for public comment in either the north or the south? Or on the phone? I am not seeing anything. Okay. Sounds like there is no public comment. We will then skip item 3, which is the review and approval of the meeting minutes from February 24. And we will move on to item 4. Well, no, we will not move on to item 4, but that's also an action item. We will move on to item 5, which is the executive summary and pre-enrollment verification provided by Janelle Davis, Exchange Executive Officer of the Silver State Health Insurance Exchange. Go ahead, Janelle.
Thank you, Chair, and good afternoon, everyone. As Valerie stated, I am Janelle Davis. I'm the Executive Officer of the Silver State Health Insurance Exchange. I will be providing a presentation as the executive summary, and a little bit different than how we ran February's meeting. We kind of combined all of the topics into one presentation, so I will be having some other staff members join in to talk about the agenda and the items that we have. So we'll move on to introductions. We have Jennifer Krupp on. She is the division administrator. So the Silver State Health Insurance Exchange is a unit under the Division of Consumer Health Services, also under the larger department entitled Nevada Health Authority. We also have Joseph Philippion. He serves as the exchange's policy manager. We have Nate Osborne on. He will be talking about the data dashboard. He is our compliance manager, also wearing 2 hats right now and still providing some data analysis for us. Katie Charlson is our communications officer, and we have hired a chief operations officer, and that is Sarah Moses. And there is more of an update in the fiscal and operational report about Sarah.
Hey, Janelle, just want to interrupt for 1 second and let you know that it looks like Levon Lewis just joined.
Okay. Welcome, Levon. Hi. So let it be noted that we do have a quorum now. There are 4 out of the 7 board members present. So if you would like to go back to the other items, I'll leave that up to you, Chair.
You know what? Just to be safe, let's do it while we can.
Yeah.
And I just want to confirm, Levon, you are on the call now? I saw her name pop up. I just want to make sure we hear her voice. I saw her name pop up. Let's just make sure. Levon, are you on? I see you there. Hi, Levon. Can you hear me? Well, I can see her, but she's not hearing me, I don't think. Are you there, Levon? I'm not sure if her volume is up, if she can hear me. Levon, are you
trying to type in the chat?
Yeah, sometimes I know it doesn't work for her, the voice aspect.
Her video's up too, so we can confirm she's in if you would like to go that route.
Okay, great.
Real quick, this is John Pashan. I haven't got my oath of office yet in the mail, so I don't know if I'm officially yet a member.
Oh, okay, let's check with our DAG.
Yeah, Jose, he did receive his letter via email from the Nevada Health Authority from me, but I don't think his oath or the paperwork that he just mentioned is not been made official. So are we still okay to move forward on the 4 possible action agenda items?
Can you clarify what you mean? That has he actually done the oath yet, or no?
According to the email, I'm supposed to get an oath of office mailed to me that I have to send back notarized. I have not got that document yet.
If we don't have that, then technically no, you're not an official member just yet.
So then is he counted towards the quorum? Would we still have a quorum then or no?
No, that wouldn't count. No.
Okay. Okay. So we will not do the action items unless we get another board member on the call.
Okay, we'll keep an eye on the attendance if Anne joins. We'll go
Okay.
back.
Okay. Thanks,
Okay.
Janelle.
Of course. Thanks everyone for your patience. All right, moving on past introductions. This is the agenda for the executive summary presentation. I'll be going over some enrollment metrics from plan year 26 and kind of where we are now. And then as I stated, Nate will go over the enrollment data dashboard update that we talked about in February's board meeting. And then Joseph will review some state and federal policy updates. There are a lot of them. And Katie will end the presentation with a communications update, and we'll, as always, leave some time for questions and answers. All right, so during plan year 2026, after open enrollment, Nevada HealthLink enrolled 104,286 enrollees. And this was in health and dental plans. But this figure on the right, the graph here, represents a 6% decrease from plan year 2025. So plan year 26 was our second highest open enrollment total for the exchange. Approximately 20% of individuals enrolled in a dental plan, including about 2,900 who enrolled in a dental plan only, brought the total to 107,216 Nevadans. 20,911 were new enrollees to the marketplace, and 42,600 were active re-enrollees. And what that means is they visited NevadaHealthLink.com to either update or make changes to their current plan. And so again, the chart on the right that you're seeing on the screen illustrates a week over week health enrollment trends, kind of comparing the last prior years. So you'll see that plan year 25 was our highest, and then this last plan year 26 was our second highest. All right. This slide is a breakdown of the unique consumers enrolled in a health or dental plan as of June 3rd of this year. So this is a little bit more of where we are right now. Most of these metrics are pretty much the same as the end of the open enrollment period, what we presented in the February advisory board meeting. You'll notice that most enrollment is in Clark County. That is followed by Washoe County. And then I believe the third highest is Douglas County. The majority of enrollees fall between 138 and the 250% of the federal poverty level. And almost half of the enrollees are 45 years old or older. Month over month enrollment is shown on the bottom left, and there has been about a 12% reduction since the end of open enrollment. This is more than double the erosion rate when compared to data from the same time last year, where enrollment was down about 5.6% since the end of OEP. So far in plan year 26, about 7,600 policies have been canceled due to non-payment. This is a 40% increase compared to last year. And this obviously contributes to a higher erosion at this time compared to last year. All right, so this slide summarizes the 91,000 unique enrollees with a health plan as of June 3rd. So this includes enrollees with both a health and a dental plan. Month-over-month enrollment is shown on the top middle, and there has been about a 12.5% reduction in health enrollees since the end of OEP. I kind of already said that this was more than double compared to last year. Looking at the top right, we can see that the average net premium for subsidized enrollees after their APTC is applied is around $237. This is up from $154 this time last year, which is an over $80 increase per enrollee, but that's on average. So again, most of these metrics are pretty similar to what we presented in the last board meeting. About half are enrolled on a cost share reduction plan. Most enrollees tend to choose silver plans, followed by expanded bronze. And then just want to note though, that expanded bronze has increased by about 8,000 enrollees since last OEP. So pretty big jump from switching from silver to expanded bronze. The federal poverty level and age breakdowns are also similar to the previous slide. And again, the target market includes the federal poverty level between 138 and 250, and again, age 45 and up. I also wanted to mention, and it's not shown on this slide, but just to give the board an update on the Battle-Born state plans, which is the state's public option. The number of enrollees in a Battle-Born state plan in June is around 10,143, or about 11% of total health enrollment. So when we presented to all of you in February, after the plan year 26 open enrollment period, we saw about a 10% total enrollment for Battle-Born state plans. So just a little bit of an increase as of June of this year, which is good. Those are holding steady. I'm going to turn it over to Nate to give this update.
Thank you, Janelle, and good afternoon, everyone. My name is Nate Osborne, and I'm the Exchange's Compliance Manager and former data analyst. As presented during our February advisory board meeting, the Exchange continues to work towards launching a public-facing enrollment dashboard that includes various enrollment metrics. Our first draft will likely look pretty similar to the metrics that Janelle just presented. We were originally aiming to launch this mid-2026, but we were a little ambitious with that timeline. With other competing priorities, we have this year launching it in time to share plan year 2027 open enrollment metrics is a more feasible goal, so we've revised our target rollout date. We are also in the process of hiring a new data analyst that will own this project. We shared some proposed metrics last board meeting and have included them all here as well. We're thinking the dashboard will include the number of exchange enrollees and enrollee status, the number of APTC and CSR enrollments, average premium and subsidy amounts, enrollees by plan type and metal tier, enrollees by FPL and age bracket, and county and rating area level summaries. And we are seeking guidance from the board on any additional metrics that would be helpful to include or any other feedback in general. The churn from Medicaid to the exchange and some additional demographic data, I believe, was suggested by the board to include as metrics during our last meeting. So as any further ideas come to you, please let us know. And once we have the first draft complete, we will share with the board for feedback as well. So that's all I have. We're very excited about the dashboard and look forward to working with the board on making it the best it can be. Thank you.
Thanks, Nate. And sorry, before we move on, I just wanted to, this is for possible discussion. So if I know there was a lot of excitement and feedback from the board in February's meeting, I know we don't have too much of an update, but just wanted to provide kind of the proposed metrics that the exchange is recommending, and wanted to get your thoughts and feedback if those look good, or if there's any others that you would like to be included as we kind of move forward with this project. So if there's no discussion, that's fine. I just wanted to make sure that we allowed space for that.
I have a quick question, Janelle, and Nate. And forgive me if we discussed this in the last meeting, do you anticipate including any demographic information about the insureds, such as age, gender, ethnicity, our employment status, those types of things that would help us kind of look for the pockets of populations that we're serving the most?
Yes, those are all potential metrics that we can include. I've definitely noted we can include some more demographic information, especially the age, gender, race, ethnicity. I'm not sure if we have employer status, but that's something we could definitely look at as well. So
Well,
I've
one thing
noted
that
those.
and one thing people like me are always anxious to understand is what populations of the employed population, who are we getting into these programs? Are there particular industries, part-time status, full-time status, employer size or employer industry industrial classification status? Those types of things are helpful for us to understand who we're serving in the employed category of insured people.
Those are all super interesting metrics, and I think we can look into what we collect on our application and work with our vendor on maybe exposing some of that data to us so we can include it on the dashboard. Could definitely look into that.
Oh, fantastic. Thank you.
Great, thanks for that feedback, Valerie and Nate. All right, if there is no further discussion on this item, we can move on to state and federal policy updates. And I'll turn it over to Joseph to present.
Hi, good afternoon, everyone. Joseph Filippi, Policy Manager with the Exchange. I have a few slides to share with you related to some recent federal and state policy updates today. I'll try not to take too much of your time. I know this is kind of a busy slide, but wanted to highlight that last month on May 15th, CMS finalized the annual Notice of Benefit and Payment Parameters rule, which governs the Affordable Care Act marketplaces, among other things. And so a key takeaway, just wanted to know at the bottom of the slide, CMS itself estimates that the rule may result in up to 2 million people leaving the marketplaces nationally, and premiums will be impacted, potentially increasing up to 2.4% in this next plan year 27 alone. And on that note, wanted to go over these different provisions of the rule. So starting on the left-hand side of the screen related to eligibility for premium tax credits for non-citizens. In alignment with HR 1, beginning this next plan year, there will be limitations to specific categories of lawfully present non-citizens who will be eligible to receive the tax credit. And those include lawful permanent residents, Cuban and Haitian entrants, and compact of free association or COPA migrants. There are many other categories of immigrants who currently qualify for the tax credits. They will still be eligible to enroll in a qualified health plan, but they will no longer be eligible for subsidies. In addition, the rule eliminates the premium tax credits for individuals whose household income is below the 100% FPL level, and who are also ineligible for Medicaid due to the immigration status. So those who are ineligible due to the 5-year bar for Medicaid. Moving on to high deductible plans, the rule expands hardship exemption eligibility to individuals who are ineligible for subsidies due to their projected household income. So as a result, the expanded hardship exemption will allow a broader population of individuals who are age 30 and older, who have incomes below 100% or above 250% of the federal poverty level. They can then apply for a hardship exemption, and if approved, they can enroll into a catastrophic health coverage plan, which, as you might know, both the catastrophic plans and the bronze metal tier plans, they are the only health plans sold on the exchange that will qualify to be partnered with a health savings account. And so I wanted to highlight that. In the middle here, related to program integrity, which is a big focus of the current administration, the rule established a required process to measure improper premium tax credit payments that are administered by state-based marketplaces such as Nevada HealthLink. Just wanted to note that Nevada participated in the program that was the predecessor of this new program. It was formerly known as the Improper Payment Pre-Testing and Assessment Program, or IPTA. They kind of rebranded it here. But Nevada was one of the first states to participate in that program, and it was pretty successful. So just wanted to note that, this is a new program for state-based exchanges, but our state does have some history and experience going through this process with CMS previously. And then moving on to new income verification rules, the final rule permanently extends the requirement for exchanges to generate data matching issues, or DMIs, when a consumer attests that their household income is above the 100% FPL, but when trusted data sources indicate different, showing that it's actually below. And it also eliminates the option for exchanges to accept a household self-attestation of income when tax data is not available. And then finally, on the right-hand side, related to the failure to reconcile rule, currently exchanges are required to deny premium tax credits to individuals who fail to file and reconcile past tax credits. Previously, I believe Nevada had a 2-year rule, so if individuals failed to file and reconcile their past tax credits for the prior 2 years, we would no longer issue subsidies going forward. This new rule is giving state-based exchanges the option to implement the 1-year look-back rule this next plan year, or we can wait until plan year 28 when it is going to be mandatory for all exchanges to have the 1-year rule, and that's pursuant to HR 1. But did want to note, currently there's a court stay order, or excuse me, vacate order on the failure to reconcile process for this existing plan year. So our exchange is currently not conducting these failure to reconcile checks pursuant to that court order, but it's to be determined if there's going to be any future orders going forward. Janelle, you have your hand up. Please go ahead.
Yeah, sorry. I just want to note that Anne just joined the meeting, and the Commissioner Gaines has to jump in a few minutes, and so I'm wondering if we can quickly pause Joseph's presentation and do a couple votes that are required. Otherwise, we're going to have to organize an ad hoc meeting.
Yeah, that sounds good.
Okay.
So we do now have a quorum, Janelle, or do I need to do a roll call or anything?
Anne, can you
Procedurally,
just let us? Oh, go ahead, Joseph.
procedurally, I think it would make sense to go ahead and just do a roll call just to verify that there are the number of board members that are supposed to be present.
Okay, I'll let you do that, Janelle.
Okay, just do like the whole roll call over again.
Probably, yeah.
Valerie Clark,
Present.
Levon Lewis,
Present.
John Pishon, although it won't count towards the quorum.
Present.
Dr. Tara Rains is absent. Ann Jensen,
Present. Thank you all.
Commissioner Gaines, oh no, did we lose him?
I see him there. I see his name.
Mm-hmm.
Commissioner Gaines, are you there? I see him, but I don't hear him. There he is.
Hello.
There he is.
Hi,
think-
Commissioner.
Yeah.
We're doing another roll call because I have a quorum just for a few minutes before you drop. So we're going to go back to the 4 possible action agenda items.
Okay, give me just a moment because I'm actually my other meeting just started. Let me let them know that I'll be back on with them and I'll be right back. Sorry about that.
No worries. Thank you so much.
Do we have any other names, Janelle? Or was that he
Just,
the
I'm
last?
sorry, Melissa Bullock, who is absent. So we do have a quorum if we'd like to move to agenda item 3 and 4.
Okay. Should I wait for the commissioner? Are you there, Ned?
Yeah, we should probably wait.
Everyone glue yourself to your seats. Don't move.
Hold on.
Thank you all for your flexibility. I'm really sorry to have been late.
No worries, Ann. Thanks.
Yeah, it's okay. Thank you.
There he is.
All right, sorry about that.
Thanks for multitasking.
Yes.
Commissioner.
Yes, thank you so much.
Okay, so we'll start
Okay.
with the agenda item 3 then, for possible action, the review and approve the meeting minutes from February 24, 2026. The meeting minutes from December were distributed. I'm sorry, it wasn't December, wasn't it? February?
Yes.
Yeah, that should be February.
From February 24, 2026 were sent out. And did everyone get a chance to review? And if so, I would accept a motion to approve.
Happy to make the motion.
Okay,
I
motion
second.
by Ann, second by Commissioner Gaines. Any discussion? All in favor, please say aye. Aye.
Aye.
Aye.
Any opposed? Okay, motion carries. Thank you very much. Then the next item number 4 on the agenda for possible action, review and approve the semi-annual fiscal and operational report pursuant to NRS 6951.370(1)B to the governor and the legislature. Do we need to have any discussion on that from you, Janelle, or should we just, it was sent out, and if everyone had a chance to review, we would entertain any questions or comments at this time.
That's perfect, Chair. And also just want to mention that the fiscal and operational report has been posted on the Nevada Health Link Board Advisory page on the website.
Thank you. If there are no questions or comments, I would take a motion to approve that.
So moved.
Thank you,
Second the
Commissioner.
motion.
Thank you, Levon. Is there any other discussion? Okay, seeing none, all in favor, please say aye. Aye.
Aye.
Any opposed? No opposed? Okay, motion carries. Thank you so much, team. So we got those taken care of.
Thank you. Thank you all so much for your patience and flexibility. That makes me very happy. And I'm sure all of you that we can get that squared away so we don't have to do an ad hoc meeting, as much as I would love to see you all again. All right. Thank you so much. That's all been documented. And we will continue with the executive summary presentation, and I will turn it back to you, Joseph. Thanks so much.
Thank you.
Sorry, just getting back to the slide. Okay. So, hello again, Joseph Filippi, Policy Manager for the record. This is just a continuation of additional provisions that were approved in the final rule of the Notice and Benefit and Payment Parameters. Related to network adequacy, the 2027 rule rescinded the Plan Year 25 rule, which formally required that state-based marketplaces maintain a network adequacy standards that are at least as stringent as those that are applied in the federal marketplace. Nevada's existing network adequacy standards will not be impacted by this change. Our standards remain the same and they're outlined in Nevada Administrative Code. And just wanted to note that the Division of Insurance currently regulates network adequacy in Nevada. Additionally, related to monetary penalties, CMPs, CMS currently has authority to impose these penalties on qualified health plan issuers who may violate marketplace requirements. In the rule includes penalties that can reach up to $100 per day per affected individual. And the new rule aligns CMS enforcement authority in the state-based marketplace with its enforcement authority in the federal marketplace. Additionally, related to a pretty hot topic right now, pre-enrollment verifications, which would take effect in Plan Year 2028. For those that don't know what those are, starting in 2028, all enrollees must actively re-verify every eligibility element before receiving federal subsidies, and marketplaces must open pre-verification processes for consumers by August 1st of 2027, leading up to the next plan year. The new final Plan Year 27 Notice of Benefit and Payment Parameters rule did not, however, provide additional clarification on how exchanges are expected to carry out these pre-enrollment verification requirements. So all exchanges, including Nevada's state-based exchange, are awaiting further federal guidance, which is expected to be released later this summer or potentially even early this fall of 26. Still discussing this final rule, just wanted to flag that there's been recently filed federal litigation that may impact when and if certain provisions take effect this upcoming plan year. The exchange will continue to monitor this court decision and any other court litigation that's filed as we prepare for Plan Year 27 implementation. So just wanted to flag that, there are certain provisions that I just kind of went over that may not take effect if this court was to vacate any of these provisions. And on that note, related to litigation, last year in 25, there was a marketplace integrity and affordability rule that was finalized by CMS that also impacted exchanges. These two provisions on the slide were actually vacated on Friday of last week, on June 12th. And what that means is they're basically this district court nullified these provisions, one of which would have required that our exchange shorten our open enrollment period for this upcoming plan year. As we've discussed with the board previously, this provision was going to require us to have an open enrollment period that did not extend beyond December 31st. Typically in prior years, Nevada has allowed open enrollment through January 15th. So that would be a big change for Nevadans. This just happened on Friday, so the exchange is still kind of reviewing and determining next steps as far as what our open enrollment period is going to look like for Plan Year 27. But just wanted to flag that this court decision will impact that. Additionally, there was a shortened window for DMI documentation requests. So previously, consumers were given a 60-day extension on top of the 90-day reasonable opportunity period to resolve data matching issues. So we had turned off that 60-day extension in accordance with this integrity rule, but the court just vacated that provision as well. So our state exchange does have the option, if we so desire, to turn that 60-day extension back on for consumers, which really would give consumers 150 days to resolve any DMIs that may impact their eligibility. So that concludes the federal updates. Before I move on to the state policy updates, are there any questions that the board has? Ms. Lewis, please go ahead.
Yes, I had just a question of clarification. In the very first part of the slide, you indicated that there was a rule, yes, that the, no APTC for populations, they were all ruled ineligible, even though they were ineligible for Medicaid due to their immigration status. So does that mean that, well, I assume that that means that that group of people will have no insurance coverage at all?
Great question, Ms. Lewis. Joseph Filippi for the record. Yes, so yes, what you're referring to is that the population who are below the 100% federal poverty level, who are also ineligible for Medicaid due to their immigration status, they would not be eligible for Medicaid and eligible for subsidized qualified health plan coverage. So to the extent that they cannot afford a full price plan on the exchange, correct, they would not be able to, likely be able to afford healthcare coverage.
Thank you.
Great question. Any other questions from the members? All right. So hopefully on a more positive note, related to our state policy updates, we have a new assister grant that we'd like to talk about. So last special legislative session that happened in December of last year, there was a bill that passed, Senate Bill 4, which allocated $2 million to the Nevada Health Authority to establish a new grant program where community-based organizations can apply for the funding to be able to support Nevadans who need enrollment, education, or enrollment assistance for Nevada Medicaid or qualified health plans sold on the exchange, including the battle-born state plans. So in alignment with the bill, our division, at the Division of Consumer Health Services, we released a request for applications on May 1st of this year. The division, we didn't know how many applications to expect, but we did receive 35 applications from eligible community-based organizations for the funding. They are currently, those applications are currently undergoing review and are being scored by a evaluation committee in the department. The committee is comprised of representatives from the exchange, from Nevada Medicaid, from our sister agency at the Division of Social Services as well. And so after those are reviewed and scored, we are then required to submit our formal recommendations to the Interim Finance Committee of the Nevada Legislature, who then has the final award approval. And we're anticipating their final award approval to occur at their next meeting in August, on August 13th. So by August, we should know the agencies that were approved for this funding, and then we can start awarding that to these eligible community-based organizations. Really, the goal at the Nevada Health Authority for these funds is to place more exchange enrollment facilitators within a wide range of community-based settings in order for them to offer direct in-person assistance to individuals who need help with their health coverage, enrollment, and education. These exchange enrollment facilitators will be able to focus on ensuring consumers complete all steps necessary prior to enrollment, help them update their applications, and help them understand new Medicaid community engagement and work requirements that are coming. in January of 27, and they'll help them select plans that meet their individual health needs. So just wanted to highlight that this is a new Navigator Assister grant opportunity, and we're really looking forward to awarding them here in a couple months. Happy to answer any questions about this.
Hey, Joseph, mainly a comment just to express my gratitude for all you and the team's hard work for evaluating all these. And I'm really excited to see the interest. From the Medicaid perspective, this is going to be an incredibly valuable set of smart and thoughtful people out in the world helping folks navigate what is a really complicated process. And I'm grateful for that. One maybe clarifying question, or two quick clarifying questions. One, can you remind me the time frame on the grant and how long? I know it's primarily years worth of funding. Do we expect that to last through all of 2027 or just until kind of August for a 12-month time frame? And then secondly, can you remind me if as part of the grant contracting, do we have kind of HIPAA covered relationships in which we could share patient information, kind of patients that may be impacted by Medicaid community engagement changes that they maybe want to outreach to? Is that something that's within our kind of partnership that way?
So yeah, thanks, Anne, for the question. As far as the timeline goes for the funding, it's actually just funding for this through this next fiscal year 27. So technically the funding has to be fully spent by June 30th of next year of 2027. So in reality, unfortunately, this grant period is only going to be about 10 months after we receive that IFC approval in August. But hopefully there might be a possibility for an extended amount of funding if the legislature were to approve that. We will see. Your second question related to HIPAA, can you clarify that for me? Sorry.
I'm just wondering, trying to get creative here, can we share lists of patients that will be renewing their coverage in the 6 months that they receive funding for? Is there kind of HIPAA covered protections to allow us to securely share that information so that they can support us with outreach to folks that may need help navigating community engagement?
That's a great idea. And yes, so all of these agencies, that was one of our specific questions, and we wanted them to ensure that they're able to meet, privacy and security rules at the related to HIPAA requirements and whatnot, since they will be dealing with, both Medicaid and marketplace populations and have access to, some patient information. And so, yes, our division can work with your division at Medicaid to ensure that any of our contracts kind of outline those expectations. I think that's a great idea to kind of proactively maybe send lists of individuals that these assisters can help with. I think really the initial concept was just having, meeting people where they are. So any of these organizations that have connections with these members of the public, if they require assistance with enrollment or meeting these requirements, that these assisters can help them. But I think that would be kind of a new thought process to kind of have them be a proactive enrollment support for those who might not come through their door per se, but who they can provide assistance to. Awesome. Any other questions?
Thank you for that. And yes, more than happy to support on that front. So let's
awesome. Thanks, Anne. All right. Hearing no more questions, Janelle, I'll pass it back to you for this.
Wonderful. Thank you so much. Okay, this slide is talking about pre-enrollment verification, or PEV, or as the feds like to call it, PEV. And what PEV is it means that there will be a stricter verification process for Nevadans who received the advanced premium tax credits through Nevada Health Link. And this is supposed to go into effect based on HR 1. This is a requirement from HR 1. In January 1st of 2028. But what that means is that the exchange will have to prepare for plan year 27. So that means by August of this year, we're working closely with our vendor and to implement the process, but we'll need to make sure that it is fully implemented and ready to go for consumers by August of 2027. So basically, who does this affect? So any consumers who are enrolled in a qualified health plan receiving subsidies, so receiving APTC, their coverage cannot begin if they are receiving subsidies until they pass verifications and those requirements are completed. So it doesn't mean, so pre-enrollment verification does not completely ban auto renewals, but it does prohibit subsidies from being applied until that verification process is fully completed. So if they're unverified, they can still renew into their plan. And then this is how it kind of affects auto renewals, but they will enroll into a plan without those subsidies until that verification process is completed. So this process applies to active enrollments during the open enrollment period for plan year 2027, as well as special enrollment period. So that's the off season. And yeah, sorry, I'm going back to what the exchange must verify. So that includes household income, family size, their eligible immigration status, health coverage status, or eligibility for marketplace coverage, and also residency. So I just wanted to make sure I hit on that piece. Sorry, quickly, I just wanted to mention too that so we're working very closely with our enrollment technology vendor, which is Vimo, to make sure that we're implementing the process in time for this to be effective in plan year 27. So definitely interested to hear from the board if there are, any concerns or feedback on, us getting ready for our consumers for this new process. But just wanted to also flag that we are still awaiting further guidance from CMS, and I believe there's even a call tomorrow to hear a little bit about what healthcare.gov is doing to prepare for this. So before we move on, any questions or comments on pre-enrollment verification?
This is really interesting. I don't know, I don't actually physically myself do this type of work, but how much time will this take someone who's enrolling a client onto the plan? Is this expected to take a long time to do this additional step, or is this something that will be fairly automated?
I think that's what thank you for your question, Janelle Davis, for the record. I think that's kind of what we're waiting on, guidance from CMS, and then also what, the state decides to work with the technology vendor on, what kind of automated processes will provide as far as system enhancements go within the platform. So definitely more to come. We want to ensure a seamless, easy process for consumers. We don't want it to be more burdensome, of course, but it will be an added documentation exercise.
Yep. Thank you. I'm anxious to hear updates on this when you have them.
Absolutely.
Oh,
I will note that down for future agenda items. We'll keep you informed.
Yes.
Thank you.
Okay, thank you. I will turn it over to Katie to talk about marketing and outreach.
Thank you, Janelle. Hi, good afternoon, everybody. My name is Katie Charlson, and I'm the Communications Officer here at the Silver State Health Insurance Exchange. So for open enrollment, or after opening, oh my goodness, I can talk. Following open enrollment, we transitioned into our special enrollment period campaign or our off-season campaign. Our strategy is focused on Nevadans experiencing qualifying life events, while also maintaining awareness among our current enrollees with the pre-enrollment verification coming in the near future. We really want to encourage people to keep their information up to date and get used to checking their plan on at least an annual, if not twice a year process. Make sure everything is up to date, including their income, family size, location, all of that. We are utilizing a full integrated media approach, including digital advertising, search engine marketing, social media, radio, community outreach, and email communications. Campaign performance has been strong, generating more than 4.2 million impressions and over 86,000 link clicks, reaching more than 100,000 households statewide. Community engagement remains one of our key drivers of awareness, with 75 community events attended and approximately 20,000 Nevadans reached through outreach efforts. And our paid media continues to outperform our industry standards. Most notably, our Google search engine campaigns achieved a 17.8% click-through rate, significantly exceeding the industry benchmark of approximately 3%. And during our off-season campaign, our communication strategy shifted from enrollment-focused messaging to maintaining awareness and educating consumers about special enrollment opportunities and available assistance to our brokers and navigators. Our key message continues to be: you may qualify for a special enrollment period if you've recently experienced a qualifying life event. If you're not sure or you need enrollment assistance, our free assistance is available year-round. We also continue to expand partnerships with municipalities, community organizations, and youth sports programs to increase visibility and build trust within local communities. Earned media coverage helped reinforce Nevada Health Link's position as the state's trusted source for health insurance information. We secured placements in NPR, KTNB, Nevada Independent, and Northern Nevada Business Weekly. We also continue to invest in multicultural engagement through our Spanish language communications. We now have a dedicated Spanish Facebook, dedicated social media content, radio interviews, and translating all of our campaign materials. These efforts help ensure that reaching Nevada's diverse populations with culturally relevant and accessible information. And our digital channels continue to be an important source of consumer engagement and education throughout the off-season. The website attracted more than 150,000 new users while generating over 1.2 million page views month over month. Significant work has been completed behind the scenes to improve our search engine optimization, accessibility, technical performance, and overall user experience. We also have begun preparations for a future website redesign with the goal of simplifying the navigation and focusing on health literacy and helping Nevadans more easily find the information and enrollment resources they need. On social media, we have shifted more towards organic content, event coverage, video storytelling, and trusted community voices. This strategy has contributed to substantial growth over impressions, video engagement, and overall audience reach. The examples shown on this slide highlight the mix of some website content, educational resources, and social media assets that we've done over the past couple months. And just a very high-level timeline of some milestones that we have coming up leading up to our 2027 open enrollment campaign. In July, we are going to bring together our Nevada Health Authority leadership and our marketing agency for a strategic planning session to align priorities and campaign objectives. Campaign development activities will begin immediately following that planning effort, including creative concepts, media planning, and messaging refinement. Creative approval is scheduled for August, allowing us sufficient time before window shopping starts. In October, we will launch our window shopping campaign to encourage new and existing enrollees to come explore their options for Planner 2027, and also start working with a broker or navigator to ensure that they're selecting the right plan for themselves and their family. We also have our yearly prep rally in October, where we bring together brokers and navigators and exchange staff to talk about upcoming changes, policy updates, and just preparing for the upcoming open enrollment period. And then our campaign will launch statewide November 1st, and will be supported by integrated paid media, public relations, community outreach, and digital engagement efforts. This phased approach ensures for readiness across all channels and maximizes our ability to reach consumers before and during open enrollment. All I have. Anybody have any questions?
Thank you. Looks really comprehensive. Does that conclude the presentation? Are you done?
Yes, that concludes our presentation. And then this
Okay.
last slide here is just some contact information, our website, and where you can sign up to receive emails from us and reach out to us with any questions or concerns. But I think you all know how to get a hold of me, and you can always ask our administrative assistant, Jenna Taylor, as well. But any further discussion or comments, questions?
No, just want to thank you for a great presentation. Your entire team looks very together, and looks like they're doing a great job with all of the various activities that you have going on. So thank you all of you.
Thank you, Chair Clark. I appreciate that.
Mhm.
It's a busy time.
Yeah, seems like it, but you guys are small but mighty. Okay, I guess that looks like the end of our agenda. We are back at the end of our meeting public comment. This item offers another opportunity for public comment. No action may be taken upon a matter raised under the public comment period unless the matter itself has been specifically included on an agenda as an action item. If you're calling in telephonically, you can press the *5 button to raise your hand or use the raise hand icon at the top of the screen if you're using the Teams application. Comments will be limited to 3 minutes per person. Persons making comment will be asked to begin by stating their name for the record and spelling their last name. Do we have any public comment at all? Not seeing anything. Is anyone else seeing anything? Oh, it looks like Curtis is asking if the slides will be shared, and Jenna responded that they will be posted to the advisory board meeting website this afternoon. Okay, thank you. Any other public comment? Okay. I'm not seeing any. I don't think anyone else is. So that being said, I'd like to thank you all for attending the Exchange Advisory Board meeting. If there is nothing further, we will adjourn the meeting. Thank you all for coming.
Thanks,
Welcome.
everyone. Have a great rest of the week.
Thank you.
All right, take care.